Hi everyone, welcome back to SG Dr. Wellness. My name is Dr. Chen Yiming. Last month, I produced a series of diet-related videos and you can click on the link on the top right now to access them. Today, I'll be talking about a problem that troubles many of my patients, and they usually present to me with burping, bloatedness, and heartburn symptoms. These symptoms may be caused by a small bacteria hiding within the walls of your stomach and small intestine. What is it and how does it look like? I'm sure you guys want to know how to eradicate them. Watch till the end to know more about it. If you're new to my channel, click on the subscribe and notification button now. What is Helicobacter pylori bacteria, or H. pylori for short? That's how it looks like, a spiral rod-like bacteria with tentacles. Dr. Barry J. Marshall and Dr. J. Robin Warren were awarded the 2005 Nobel Prize for Medicine for their work in discovering the Helicobacter pylori bacteria and its role in gastritis and peptic ulcer disease back in 1982. How it all started was when Dr. Robin Warren, a pathologist from Perth, observed small bacteria colonizing the lower part of the stomach in about 50% of patients who had their stomach biopsied. He also observed that signs of inflammation were always present in the stomach walls close to where he saw the bacteria. Dr. Barry Marshall, a colleague, became interested in these findings, and they together succeeded in cultivating this previously unknown bacterial species. And until then, the medical world was still entrenched in the belief that lifestyle caused gastric ulcers. Today, it has been proven already that H. pylori causes more than 90% of duodenal ulcers and 80% of gastric ulcers. Now, before I discuss the importance of H. pylori, let's dwell a little bit more about gastritis and ulcers in the stomach and small intestines. Some of the common symptoms of gastritis and ulcer disease are abdominal bloatedness and nausea, burping and belching, abdominal pain, heartburn, bad breath, loss of appetite, and in severe cases, even loss of weight. Now think about it, I'm pretty sure most of you have had one of the symptoms that I've just mentioned. In fact, an estimated 50% of adults in the world today has H. pylori infection. It's higher if you are in a developing country and lower if you are in an industrialized, developed country. 50%, that's pretty high, isn't it? And when the gastritis and ulcer disease are severe, they may even lead to bleeding from the walls of the stomach and intestines, resulting in you feeling fatigue and having fainting spells, anemia or low blood count, black foul-smelling tarry stools, in severe cases even hemorrhage, which may be fatal. In the long run, it can even lead to gastric cancer. Of course, some of the other known causes of gastritis and ulcer disease includes smoking and drinking, regular use of pain medications called non-steroidal anti-inflammatory drugs, or NSAIDs for short, which includes aspirin and ibuprofen, stress. However, it's still not known exactly how H. pylori spreads. Researchers suspect that it may be spread via unclean food and water or through contact with an infected person's saliva and bodily fluids. Risk factors to getting it includes overcrowding and poor sanitation or habitation conditions. Therefore, good hand washing and drinking clean water are some of the ways to prevent getting a H. pylori infection. Evidence has also shown that adults aged 50 and 60 and above tends to have higher prevalence of H. pylori within their gut. When the bacteria enters our body, it attaches itself onto the walls of our gut and produces a toxin that causes inflammation. If it's not treated, prolonged inflammation may eventually result in ulcers and cancer formation. So, logically speaking, anyone with symptoms of gastritis and ulcer disease should get themselves checked for H. pylori infection. There are a few tests that we can do to detect this small little bacteria. The most accurate test of all will be a gastric endoscopy. So a small camera will be passed through the mouth and esophagus into the stomach and small intestine. Through this tube, a small sample of the stomach wall lining can be collected and sent for biopsies and claw testing. Through the biopsy and claw test, a confirmation of H. pylori bacteria infection can be detected. The advantage of this test is that a visual confirmation of gastritis or ulcer disease can also be confirmed, and gastric cancers can be excluded. Alternatively, a non-invasive test would be a urea breath test. This is a simple, non-invasive test where you are required to blow into a bag before and after swallowing of a pill to see if the carbon dioxide level rises when you blow into the second bag. An increase in carbon dioxide will indicate a H. pylori infection. This is also a very good test to be done in children whom a H. pylori infection is suspected, as young children may not be good candidates to go through an endoscopic procedure. There are a few other tests such as blood testing for H. pylori antibodies, stool testing for H. pylori antigen, or a H. pylori culture to attempt to grow the bacteria from your stool sample. So please see your doctor to discuss which method is the most appropriate for you and your condition. Now, good news is that there are effective treatments to eradicate H. pylori infection, and it involves using a combination of gastric acid reduction medications with antibiotics in what is known as triple therapy or quadruple therapy. However, there are cases of antibiotics-resistant H. pylori infection and also cases of reinfection following eradication of the bacteria. Therefore, follow-ups are often necessary to ensure treatment success. Gastritis and H. pylori infection is a very common issue that I see in my family medicine practice. It's close to my heart as I personally suffer from gastritis as well. I hope this video provides some insight into your condition. See your doctor to get it checked if it's bothering you. Please share the video with your friends and loved ones who are suffering from gastric symptoms. Like and subscribe to my channel if you find it useful. So till the next time, stay safe, stay healthy.